just wanted to provide a quick update and answer a few questions or responses to comments on my previous post. First of all, thank you so much for taking the time to read it. Having interest at all in my story is encouraging for me. The first question I would like to respond to is, why don't I just go back to the emergency room or another emergency room? Because I was told that there is nothing acute, or it's not an emergency situation. And when you have medical anxiety, PTSD, medical trauma, and you deal with chronic illness and chronic pain, all of those are very difficult to manage. And can make making those decisions extremely trying and challenging. Trust me, not knowing when my body has had enough is a struggle I face every day. I have yet to receive a response from my primary care provider, although she did enter an order for some blood work. My gastro is still out of the office, and the general surgeon did confirm the fact that I have no spleen and requested that the radiologist update the report, in which they did. They added an addendum that states that the first report was incorrect and the patient in fact has no spleen, but added no clarity as to whether something was seen or if it was just a template error. I understand mistakes happen, and I am okay with that, but clarity, knowing if in fact there is a large mass of something where that should be, is of course concerning, especially since a few months back I had a pancreatic cyst on the tail of my pancreas, and I just want to make sure that there's no abscess, there's no infection, that cyst isn't growing. And I think these are all legitimate concerns and very black and white question to be answered. I called the nurse on call and actually spoke with two separate nurses. Both tried to reach out to my provider's office. They're gone for the day, and told me, well, can't you wait until tomorrow to find out? I asked if I could have a second opinion, have another radiologist read the CAT scan report, and both nurses informed me they were unable to place that order, that they recommend I follow up with my primary tomorrow morning, which I have all intentions of doing, but since I've already been waiting for 2 days, that doesn't help set my anxiety at ease today. It's a constant struggle and a lot to deal with and a lot to manage. I appreciate anyone's time that's following along, and any feedback is greatly appreciated. Thank you.